Hi, this is Michele Nadeem-Baker, your patient power reporter, live at ASH for you today. It's Saturday, and there is so much news that has been being shared, and I want to give you one huge summary about what I'm hearing here, and that is hope. There is so much hope for CLL patients with all of the different treatments that are in study. There's combination therapies that we've been hearing about. There may be chemo in the future, there may not. I'll tell you more about that in my report here. And now that we know of combination therapies with 2 different kinds of drugs, now we're hearing about 3. So hold on, because there's a lot of news today I'm going to share. So first I want to tell you about some findings that were presented today on the Captivate trial. I know some of you had written to me that you're on it. And the Captivate trial, just for everyone else, is ibrutinib and venetoclax. We heard from a few doctors today regarding their findings on it at their centers. One was Dr. Nitin Jain, who's a friend of ours here at Patient Power, and I will be interviewing him later this weekend. But the findings are really, really positive. It's a chemo-free combination treatment. Remember, ibrutinib is a BTK inhibitor, and venetoclax is a BCL2 inhibitor. So patients have to be at least one of the following things I'm going to say or more. So one would be 65 or older, or 17p deletion, 11q deletion, or TP53 mutated or unmutated IGHV. So those are the parameters of who is on the cohort that's been studied. After 24 cycles of being on ibrutinib and venetoclax, when that's added in, 24 cycles, many reached MRD negativity, undetectable MRD. For those who do not reach MRD negativity at 24 months, they have the choice to stay on ibrutinib indefinitely. At that point, they'll be letting us know more of the study. But there is a very high incidence of undetectable MRD in the study. So that is great news on the Captivate trial. Another trial is called AVO. It's a acalabrutinib and venetoclax and obinutuzumab. This is being studied at Dana-Farber Cancer Institute, and it's a fixed duration. We're going to be hearing a lot about fixed duration in the future. In our pre-ASH interview, we heard about fixed duration is what people are trying to determine because they've been seeing certain toxicities the longer you stay on some of the treatments that are happening. So it's for fixed duration, it's phase 2, it's for frontline patients who have never been treated, and high-risk patients. And they're calling it a triplet combination because it is the 3 things, the acalabrutinib, venetoclax, and obinutuzumab. Try to say that past 3 times. So there is a very high percent, and preliminary data, very high percent of undetectable minimal residual disease, MRD, and a lot of what they call CR, which is complete remission. This is wonderful, and that's including high-risk categories of TP53, 17p, 11q deletion, and there's no significant cardiac incidents or bleeding toxicities. There's no significance with those, which we're seeing on some of the other treatments that are out there. So there is a big future for this trial. They're expanding the trial, so they're looking for more people in the cohort, and also they're going to be now also having a head-to-head of this trial versus chemotherapy and a head-to-head of this versus acalabrutinib and venetoclax. So stay tuned more for that. That would be at future ASHs. So also there's another trial called, it's the E19 trial, it's the follow-up on that, which is ibrutinib and rituximab. They're finding it provides superior outcome versus FCR. So it's ibrutinib plus rituximab versus FCR, which had been the gold standard of chemotherapy treatment for years. And it's for younger CLL patients. I'm sorry. Let me say, in younger CLL patients, having a fantastic results. That's where it's the greatest that you see that there's a difference. But it's also very good for everyone else. But it's just even a greater success rate in younger patients with unmutated IGHV. So it's showing great success rates versus FCR, which leads me to wonder, Is chemotherapy FCR going to be a thing of the past? We're going to find out. I was at a presentation today where they were saying no, there's going to be a place for it still. But there is a session, I believe it's on Monday, that I'll be reporting on that asks, is it the death of chemotherapy? So we're going to find that out as well for you. So you're gonna have to stay tuned more than just today. There is another trial I wanted to tell you about that a lot of people have been talking about, and that's the Elevate TN trial. It's acalabrutinib and obinutuzumab, or just acalabrutinib. You may remember that was a drug that was approved by the FDA last year, or it's acalabrutinib and chlorambucil. So this is frontline treatment again, and the findings are that acalabrutinib and obinutuzumab, I wish I had a whiteboard, I could be drawing all this out with the letters because it is such alphabet soup out there. So acalabrutinib and obinutuzumab and just acalabrutinib significantly improved progression-free survival versus obinutuzumab and chlorambucil. So also you're going to be seeing maybe on, if you're looking on social media about ASH, you'll see PFS, that's progression-free survival, which is something that we would all love to have. And if it says U-MRD, it's undetectable minimal residual disease in your bone marrow, which is also what we want. So there are so many other things to share with you, but so many other trials coming up. There's also the Sequoia trial, GLOW, Unity CLL, and some that I can't even pronounce. Some of the other things I want to tell you that I'm hearing, I would say on the street here or in the corridors here at ASH, is that there really are so many different posters that I plan on going to and sharing some more information with you on. And a lot of the talk in the press room is about all of the CLL news that is happening this year at ASH. Many of you had written to me about these trials that you are on and asking about them. I'm trying to hunt down the doctors that are the ones that are leading them. So I'll be letting you know also about that. But the bottom line is there's great hope for us as CLL patients. People are going to be living longer. And a few doctors I spoke to, including Dr. Bill Weirder, MD Anderson, said a cure is in sight. This is Michele Nadeem-Baker reporting, and I want to invite you and remind you to join me both tomorrow and also on Monday at 5:30 p.m. Eastern Standard Time, 2:30 Pacific, here on Patient Power. Thank you.